Dry needling is a unique modality of physical therapy that is becoming increasingly popular with therapists and their patients. This technique uses solid needles to treat specific trigger points in muscles that are causing the patient pain. It is called dry needling because no liquid goes into the body, as in the case of vaccinations or hospital IVs. Trigger points are highly irritated spots in the tissues of the skeletal muscles. They are presented as nodules or knots in the bands of muscle fibers. Many things cause trigger points. They are formed when muscles are stressed or injured, and when formed, cause pain and muscle tightness. Studies indicate that trigger points may be the underlying cause of nearly 85% of pain-related visits to primary care physicians. After identifying the location of the trigger point, the therapist will work the needle back and forth through the spot to help stimulate the muscle to relax. As the needle is inserted, patients usually feel the muscle fiber involuntarily twitch or quiver. These twitches show the therapist that the muscle is starting to relax. As the muscle relaxes, there is a reduction of joint, nerve, and tissue compression. The more relaxed the muscles, the better they feel. The needles used for dry needling are very similar to the needles that are used in acupuncture. Dry needling uses a sturdy FDA-regulated needle that has a diameter of 0.25 millimeters. As you can see displayed in the picture, it is significantly smaller than the needles commonly used for vaccinations or hospital IVs. Acupuncture is based from ancient Chinese medicine and puts its emphasis on the body's energy and the possible imbalances to that body's meridian energy lines. In acupuncture, the needle penetrates into the dermis of the skin. However, it does not pierce through into the underlying muscles. Conversely, dry needling is based from Western medicine on neuromuscular science with an emphasis on bringing muscle functions back to normal. Instead of stopping in the patient's dermis, the therapist usually fully inserts the needle completely through the dermis and into the underlying muscle, with the idea of hitting the knot and stimulating the muscle to relax. Physical therapists realize that dry needling alone cannot fix someone's injuries. Therapists view dry needling as an important supporting modality that increases the effectiveness of continued hands-on therapy, where the therapist uses more manual manipulations to encourage progress. There are many questions about dry needling a patient might have if this treatment is being recommended. The most frequent question asked is, does it hurt? There is typically some discomfort when the muscle is involuntarily contracting. I, for one, have had dry needling treatment on my back after I was in a car accident. I didn't feel the needle enter my skin, but as the therapist palpated the trigger point back and forth with the needle, I felt like the targeted muscle band was spasming. Another description of the discomfort could be that it felt like each individual muscle strand was having its own mini Charlie horse cramp. Another frequently asked question is, how does the body feel afterwards? Muscle soreness is normal for the rest of the day following the treatment. It's also common for muscle soreness to occur the next day as well. Patients also tend to experience a wave of tiredness following the treatment session. as well as occasionally some light bruising. Therapists generally encourage their patients after their first treatment session to go home and ice and stretch. This is less part of the healing process and more just to keep the patient comfortable. One more frequently asked question is whether or not dry needling is covered by medical insurance. In the eyes of the insurance company, dry needling is still viewed as an experimental treatment. This is why they are unwilling to pay for this treatment. A general typical fee for a session of dry needling is usually around $45 out of the patient's pocket. In summary, trigger point dry needling is a technique that physical therapists use to reduce patients' pain and improve their flexibility and range of motion, all the while speeding up the recovery process.